Well, it's not widely known, but research shows that pneumonia cases increase during April and May. It's important to recognize the symptoms so treatment isn't delayed. Joining us now to talk more about it is Dr. Nabeen Sapkota with Columbus Community Hospital. Thanks for joining us today.
Thank you.
I didn't realize that pneumonia increased during spring, so why is that?
Yes, actually studies have shown that there are two peak seasons for pneumonia. The first one is in November, December, and the second peak is around April and May. In kids, the winter season is worse, but in adults, actually more cases appear in spring than in winter. The exact reason is not clear. Could it be related to increased allergens, increased pollens in the air? It's possible, but they haven't found out the exact cause.
So tell us about the symptoms of pneumonia, and maybe how would you know you are maybe dealing with that?
Yes, to understand the symptoms of pneumonia, you have to look at it at two different levels. One is at the organ level, and the other one is at the body level. At the organ level, pneumonia is an infection of the lungs, and it is a deeper infection, unlike flu and cold, which are usually just upper respiratory tract infection. They don't go as deep as pneumonias do. In pneumonia, these bugs, they go down and settle down into these deep pockets inside your lungs. There they cause irritation, inflammation, and they can produce some pus-like fluid. So this irritation, it causes you to have a bad cough, and it can make you have some chest pain while breathing or coughing. And that inflammation, it makes you short of breath. And the fluid that collects in your lungs, that can interfere with gas exchange, and it can bring the oxygen level in your blood down. And you can get hypoxic, and you can have shortness of breath. But at the organ level, these bugs, they produce these toxins. These toxins get absorbed from your lungs, and they go out into your general circulation, and that causes you to have fevers, chills, weakness. It can cause your heart rate to go up, and it can cause your blood pressure to go down, and sometimes it can even cause confusion and just weakness and lethargy.
So we have about 20 seconds left. What about treatment? How does someone treat this?
Well, the treatment depends on the patient. If you are otherwise young and healthy, you just need to call your doctor and get some antibiotics. You can stay home and take the antibiotics, and you'll be fine. But if you have a chronic medical problem, you're not very healthy to begin with, things can get worse very rapidly. So if you have any symptoms, and if you're not in very good health, you need to get to the emergency department right away. And then they will put you in the hospital, start you on IV antibiotics, and put you on some oxygen. And if that doesn't work, they may have to hook you up to a breathing machine to support your breathing while you're being treated.
Okay, well, thank you so much for the advice, and good idea to be kind of aware of the possibility of pneumonia during the spring season. Dr. Nabeen Sapkota, thanks for joining us today.
Thank you very much. And you need to be especially careful in elderly and patients with chronic illness.
Okay, very good. All right, and we're back in a moment with a final look at your forecast.